question here, the nurse recognized that which factors place a client at increase the risk of fall, right? So if you find out the factor for fall, you can prevent the fall, because 95% injury occur because of falling. So prevention of falling is important. So they said, out of the 6, which one indicate the risk of fall? Select all. If patient age is 50, so if anybody age is 50, it does not mean they increase the risk of fall. If the age group is more than 65 or 70, chance of falling. Diagnosis of ovarian cancer. It does not make any sense. The journal does not support. There are no evidence ovarian cancer related to the fall, or ovarian cancer does not cause any cognitive impairment. Number 3, so when patient is lie down, the pulse rate 80, but when patient is stand up, the pulse is 110. So what are the difference between these two? Pulse rate is changed due to the posture changing. If it is more than 20, means patient has a orthostatic hypotension. And we know orthostatic hypotension increase the risk of fall. So number 2, 3 is important. In this question, it would be easy for you if the examiner wrote the blood pressure, but they wrote about the pulse rate. And pulse rate is gap more than 20 beat per minute. Number 4, osteoarthritis of knee joint. So inflammation in the knee joint causes the restriction of movement of knee, the chance of falling. Take the carbidopa and levodopa. So number 5, little bit you need how to thinking and find out. So carbidopa and levodopa, who take it? The patient who is diagnosed by Parkinsonian disease or Parkinson disease. So Parkinson patient have a gait abnormality. They have a chance to fall. Also, carbidopa, levodopa can cause drowsiness, dizziness, the chance of fall. Number 6, use a cane for ambulate. So the patient who is immobilized, they can use the scratch or cane, right? So if the patient use this type of materials, they have a chance to fall, right? We have to find out what are the underlying risk factor and prevent it, correct it, educate your patient how to use it. And by this, we can prevent the falling. What are their explanation? They said, positive orthostatic vital sign means raise in pulse rate more than 20 beat per minute indicate increase the risk of syncope and fall. Orthoarthritis of the knee means knee inflammation, knee pain, and limit the joint mobilities, increasing the risk of fall. Presence of IV therapy, wet floor, room congested with furniture, improper toilet seat, or bed high are the factors that increase the risk of fall. If in your room there are no adequate light, the elder citizen can fall. Carbidopa levodopa is a medication we use for anti-Parkinson disease. Parkinson disease increases the risk of fall due to the gait abnormality we call shuffling gait. Carbidopa and levodopa, and a combination of these two drugs we call Sinemet. Basically, carbidopa and levodopa, when used together, they can cross the blood-brain barrier and may also cause the dizziness, involuntary movement, and also causes orthostatic hypotension. So increase the risk of fall. Use of an ambulatory aid such as cane, walker, or scratch indicate a balance or gait problem, and also the client at the risk of falling. What are the education objectives? Fall risks include using assistive ambulatory device or orthostasis or taking sedation or anti-Parkinson medication, or if your patient age is more than 65 to 70, patient chance of falling. So question here, a healthcare provider is preparing a client for below the knee amputation surgery, right? So a LPN or RN preparing a client who need the amputation surgery. Which action should the nurse complete? Select all type. Number one, admin a pre-operative antibiotics. So according to the policies or guideline, before to start any kind of major surgical operation, we have to start a pre-operative antibiotics. It is very important to know. Number two, ensure that the correct limb to be amputated is marked appropriately. Again, I could say it is the policies that before operation we have to use a marker to identify which limb is need to operate, just to prevent the error. So ensure that the correct limb to be amputated is marked appropriately. Place a red no known allergies bracelet on the client. This information is not true. We only put the red bracelet if anybody have known allergy to any particular things. So it is not correct. Place the operating permit in the client chart. Place the operative permit in the client. Definitely it is. Prepare the current 20G IV catheter with an replace the said 20G IV catheter with 80G. So it is, you can see this is the cannula, different caliber, 40, 60, 18, and 20G. When you start a IP channel, it is good to start with ADZ. But if you want to continue further, it is good to replace ADZ by 20Z, because 20Z is, if your patient need to the blood transfusion, 20Z is best option, right? In this picture, we can see butterfly needle with two wings, right? About this important, let me read. If the client does not have IP line started yet, it is good to use ADZ, 18G would be preferable. However, if the client has a functioning IP line present, then 20Z is most likely acceptable. Blood can be transfused through 20Z if necessary. But in this question, this is the opposite. Replace the current 20Z with 18. No, wrong. What is their explanation? The Joint Commission's, the National Patient Safety Goal include preventing the mistake in surgery. The goals state, make sure that the correct surgery is done on a correct patient and at the correct place on patient body. The correct surgical site is marked preoperatively with a permanent marker. A measure by Center for Medicare and Medicaid, and that the Joint Commission state that prophylactically antibiotic is to be given within 1 hour prior to surgical operation. Universal truth when you take care of the patient who need a major surgical operation. It is also a standard of practice for the nurse to ensure that appropriate operative permit have been signed and placed on the patient chart. What others? When preparing a client for surgical operation, the nurse needs to ensure that operative permit are signed and on the chart. It should be on the chart. Allergic band is placed if allergy are present. Operative site is marked on the limb, and IV prophylactics antibiotics are infused within 1 hour before surgical operation. This is information we must need to know for NCLEX board exam. So a community mental health nurse is a member of a mobile crisis team and providing services to the victims of a Category 4 hurricane. Of these strategies, which would be the priority of action for the team to utilize in teaching those who need the mental health services? So in this question, the examiner wants to know what are the best options to reach out to the victim. Definitely this question about the mental health services, but they're victimized because of Category 4 hurricane. Out of 4, which is the best way to catch up, to reach out to them? So contracting other social service agencies. Number 2, knocking door. It is not possible to knocking door to door. Maybe the peoples are not their home. They went to the shelter. Putting the flyer, it is difficult. Putting flyer and everybody should read or do not read. Who make it sure? Number 4, reporting into the local comment center. So when they broadcasting the info, it would be easy to reach to the people, right? So it is the best option out of these 4. Reporting to the local comment center, broadcasting center. What is their explanation? Let me read it. Individual impacted by emergency, such as the natural disaster, often experiencing severe emotional stress and are in need for mental health services. The client may experience a wide range of emotions, and reaction include confusion, fear, hopelessness, grief, survivor guilty, and anxiety. So all of these mental oriented. Maybe you lost somebody, your friends and family, so hopeless, grief, and who is survived, but your friend are not survived, you feel guilty. And you do not know what you eat, where you get the pure drinking water. It makes you anxiety, stress, fear, confused. Mental health professional can provide the support, crisis intervention, and promote the how to coping with the present environment or disaster. Services maybe provide a shelter, food distribution center, or propped up disaster relief center, school, religious place, or in homes. However, the findings and reaching potential client and family member in the aftermath of disaster can be challenging because the client may not know where or how to get the help. The client may be afraid or unable to leave their home. Telephone services or other lines of communication may be disrupted because of hurricane. Potential client may leave their home and go to the shelter or alter the housing. Also, transportation may be severely limited because of, again, I say, natural disaster. It is essential to coordinate outreach the effort to the maximize resources and avoid the duplication of service and insufficiency in providing services. The mobile crisis team's priority action is to check in with the local command center, then to assist in the planning outreach strategies with the other community agencies. So first priority is a command center, then community agencies. So what are the educational objectives. Individual impacted by natural disaster or emergency are often in need of mental health services for assistance in coping with a wide range of reaction and emotion, including fear, confusion, hopelessness, and anxiety. Outreach strategy in aftermath of a disaster need to be centrally coordinated by various community agencies providing the service in order to maximize efficiency and avoid the duplication effort. Question here, the nurse preparing to care for a client being admitted with a confirmed diagnosis of a middle-aged respiratory syndrome. Which personal protective equipment will the nurse use when providing the client? Right? Your patient is diagnosed by the middle-aged respiratory syndrome. So now we said what protective equipment better to wear when you give them services. Okay. So this Middle East respiratory syndrome, it is basically a viral respiratory illness and caused by a coronavirus. Coronavirus has a different types. Which one first came in the Middle East? We call Middle East respiratory syndrome. And this Middle East respiratory syndrome is a contagious, very contagious, and sometimes very fatal respiratory illness they causes. And it is often spread through the close contact with an infected person. So it is better if we precursor for airborne, contact, and standard precursor. Means hand washing, wear the gloves and gown, wear the N95 respirator and eye protector, because the Middle East corona respiratory syndrome is a contact and airborne precursor we should follow. There is out of 4 gloves and gown, gloves and masks, ground and N95 respirator. But number 4 only contain all of the personal protective equipment like ground, gloves, N95 respirator, and eye protector. So Middle East respiratory syndrome is a viral respiratory illness caused by coronavirus. And the incubation symptom include fever, cough, shortness of breath that often worsen and causes the death in many of those affected persons. As I told you, it is contagious and sometimes very fatal respiratory illness, and it's often spread through the close contact with an infected person. Incubation period 5 to 6 days. So when any person is infected, it takes 5 to 6 days to produce the sign and symptom of the disease, like fever, cough, shortness of breath. How the virus spread is not fully understood, but it is thought to spread via respiratory secretion because it has easily spread to those who care for infected person. So health worker like us, doctor, RN, LPN, we are under the risks to catch by the virus. So the CDC, Center for Disease Control and Prevention, recommended to use of standard precursor, contact precursor, and airborne with a eye protection. So when you give care for the client who is diagnosed by Middle East respiratory syndrome, education objectives, standard, contact, and airborne precursor with eye protection should be used when caring for a client with suspected or diagnosed by Middle East respiratory syndrome. What next? Next question here. A nurse in surgical admitted unit is preparing a client for elective coronary artery bypass surgery. Which statement by the client should the nurse report immediately to the healthcare provider? So your patient is ready for coronary artery bypass surgical operation. So something wrong with your patient, you need to inform healthcare provider. Number one, they said, I have not had anything to eat or drink since 8 p.m. yesterday. Yes, if any major surgery, you have to be nothing by mouth. So the previous night. So number one is okay. Number two, I took my antiplatelet medication like Parsugal this morning with just a tiny sip of water. It doesn't matter how much water you drink, but before any major surgical operation, every patient must stop the antiplatelet medication like Parsugrel or clopidogrel. You have to. Otherwise, surgeon will not go for any kind of surgery. So definitely it is wrong. Patient did a mistake. We need to inform to the healthcare provider. Number three, I'm really nervous about the surgical, about this surgery. It is common, makes sense. Everybody will be like this. Number four, it always takes several attempts to start my IV. It is natural conversation, does not make any big difference. So number two, we found we need to immediately inform healthcare provider because something is going on wrong. So what is explanation? Antiplatelet medication like Parsugrel or clopidogrel are often prescribed to the client after a percutaneous coronary intervention such as angioplasty or stent replacement. These agents should be stopped at least 5 to 7 days prior to the surgery. So for NCLEX board exam, you must know. So any kind of antiplatelet medication, we should be stopped at least 5 to 7 days prior surgery. Why? To reduce the chance of intraoperative or postoperative bleeding. The nurse should immediately report to the healthcare provider that the client is still taking Parsugrel or took it in the morning of the surgery. So what are the education objectives? Let me redo this. Medication that cause increase the risks for bleeding include anticoagulant like warfarin, heparin, include antiplatelet like aspirin, clopidogrel, Parsugrel, or dipyridamole. We could hold it. We should stop it at least 5 to 7 days before any kind of major surgical operation. You must know for NCLEX board exam.